very warm welcome to all the participants to this session titled Subsidies Viewed Through an Equity Lens, Rethink and Reform. So first and foremost, a kind reminder to you all, please note that the session is being recorded. The session's recording will be made available to everyone. Please mute yourself whilst not speaking and kindly turn off your camera during the session. So only the presenters will have their cameras on, and this is because we want good connectivity for you all. So please wait until your questions, until the Q&A section, and you can of course already post your questions in the chat as the presentations are going on. So with that said, my name is Doreen Barlow. I work as a policy advisor in the GIZ sector program, Sustainable Sanitation, and I'm based in Bonn, Germany, and I'll be moderating this session together with my colleague, Amanda Mallaghan. Amanda, you can introduce yourself.
Hello, everybody. I'm Amanda Mallaghan, and I'm an advisor working with the reform of the water sector program in Zambia.
So as mentioned, we have quite an exciting session lined up for you today, focusing on subsidies. Now, the objectives of this session is basically to increase awareness about the magnitude and regressive nature of WASH subsidies and the potential of better targeted subsidies that leave no one behind. We also want you to leave this session with a more in-depth understanding of the inequality of current subsidies within our sector, and also provide inspiration from the respective presenters on how we can accelerate pro-poor subsidies reform in the sector based on the inputs. So we'll first start, as you can see from the agenda, by looking at the current status of subsidies through a presentation from the World Bank. It'll take into consideration aspects like trade-offs that could exist, strategies on how to improve subsidy design, and also the need for well-targeted subsidies. And without further ado, I'd like to introduce you to our first speakers from the World Bank. We have Luis Andres and Michael Thiebert, who will provide input on the subsidies topic more holistically with an overarching lens. So Luis is a sector leader in the water global practice at the World Bank. His work at the bank involves both analytical and advisory services with a focus on infrastructure, mainly in water and energy sectors. He works on impact evaluations, private sector participation, regulation, and empirical microeconomics. He has authored several books, monographs, and articles on development policy issues. And most recently, he was the lead author of the very much anticipated World Bank publication, Doing More with Less, Smarter Subsidies for Water Supply and Sanitation. Michael Thiebert is a water and sanitation consultant and also works for the bank in the water global practice. He has over 15 years of diverse experience in water and sanitation, and was also one of the authors of the World Bank publication that looks at subsidies titled Doing More with Less. So a very warm welcome to our sector colleagues from the World Bank. My colleague Lena Lichte, as mentioned before, she will share her screen with your presentation and will click through as you guide us through the content. Lena, I hand over to you, and Luis and Michael.
Thank you, Doreen, and good morning, good afternoon to everybody. It's a pleasure to be in this virtual session. And let us start the presentation at this stage. The genesis of this work was something that, at least here at the World Bank, we have been sort of absent in this discussion about subsidies. So the whole idea of this work that Mike, myself, and some other colleagues have been working on trying to revisit in terms of what is our position and our standing on subsidies in the water sector, and the water supply and sanitation sectors. So next, please. So the whole idea of the report is to bring this back on the table, right? To discuss again about what is this about, and eventually what are the things that we have been understanding from the last 10, 15, 20 years. I mean, and they are still valid, but what are the other things that we may need to revisit, right? I mean, next, please. So the whole bottom line is that we still believe that subsidies are needed. definitely needs. I mean, in the sector, I mean, there are several, as we will see later in the presentation, there are several subgroups of the population that still need some support from the government. But definitely, there's a lot of things that can be done better. I mean, we found that there are several instances for which subsidies are not very well targeted, are not well efficient. And the whole purpose on this is to revisit what we can advise, what we can do in order to do a better design of these subsidies. So let me hand over to Mike for the rest of the presentation. Thank you, everybody. Mike, over to you.
Thank you, Luis. Good morning, good afternoon, good evening, everyone. So we want to first flag that it's governments who decide what to subsidize. We are only trying to inform the conversation. Next slide. So we began our research focused on answering one overarching question facing policymakers across the world. And that is, how can scarce public resources be used most effectively to achieve universal delivery of water supply and sanitation services? In order to get there, we began by developing a common understanding of the many types of subsidies that exist in practice. And that includes both explicit financial transfers as well as implicit transfers that occur when products, services, or inputs are underpriced. We then used this data currently available within the sector to analyze the performance of subsidies around the world, what is working and what is not working. Our findings then allowed us to provide explicit guidance to policymakers that both inform smarter subsidy design and advise on how to go about that reform. In the end, our report is structured around three key messages. Next slide, please. Our first message is that current water supply and sanitation subsidies are pervasive, expensive, poorly targeted, non-transparent, and distortionary. Subsidies are common across all countries, irrespective of region or income level. They tend to lack transparency, providing cover for some service providers to misuse scarce public resources, therefore failing to benefit their customers through improved service quality or reduced costs. And poorly designed subsidies are distortionary. By failing to provide the right market signals to encourage efficient production or consumption, they contribute to inefficiencies and may even threaten the sustainability of service itself. Utilities may find themselves trapped in a vicious circle whereby low prices lead to revenue losses and required maintenance is postponed, leading to mounting losses, shortening the lifespan of assets, and reducing service quality and coverage. Next slide, please. We estimate that governments around the world spend around $320 billion every year on subsidies. That is up to 2.4% of GDP in some regions. Yet with all this money spent, what are we getting? Well, subsidies all too often fail to reach the poor. In an analysis of 10 low and middle income countries, we found that 56% of subsidies end up in the pockets of the wealthiest 20%, but only 6% of subsidies find their way to the poorest 20%. And although these results seem bleak, and they are, there is good news. Next slide, please. Although current subsidies tend to be inefficient at achieving their policy goals, such poor outcomes are not a given. Instead, we know that subsidies can be designed to cost less and do more. They can be smarter, better targeted, and implemented effectively. Next slide, please. In doing more with less, we provide a framework to guide policymakers in improving the efficacy and efficiency of water and sanitation subsidies. This framework requires the careful consideration of 5 key questions. First, what is the context? Socioeconomic, cultural, political, and environmental factors, service delivery modalities, levels of institutional capacity, and fiscal space all vary from place to place and are all relevant to subsidy design. This implies that a one-size-fits-all approach is not an option. Therefore, our framework begins with a thorough understanding of the context at hand. Next, what are the policy objectives that the subsidy seeks to achieve? A single policy instrument is unlikely to meet all policy objectives simultaneously. Is the focus on expanding access to unserved populations, reducing the cost of service to existing users, or maybe reducing adverse environmental impacts? Each desired outcome will likely necessitate a specific policy instrument for its achievement. The third question, what are the targeted services and/or populations, is particularly relevant for this session as we discuss on-site sanitation in Lusaka. I will discuss this in more detail in the next slides. It is then important to identify a funding source that is sufficient, transparent, and predictable. We must consider who is ultimately paying for and conversely benefiting from the subsidy. In some cases, a broad base of taxpayers may end up funding services for a much more narrow, richer subset of the population. This is the case for networked services in many countries, and such a scenario is clearly regressive and is to be avoided. And the last question involves assessing the efficacy and efficiency of various subsidy design alternatives and their feasibility of implementation in order to determine the best path forward. Next slide, please. So moving back to the question on the targeted service and population, given the scarcity of public resources, any decision to allocate subsidy to one subsector over another entails inherent trade-offs that must be carefully considered and debated. Next slide, please. For example, governments tend to over-allocate subsidies to water supply over sanitation and to sewer over on-site sanitation services. In some contexts, this may be warranted. However, this decision merits reconsideration. Poor sanitation, after all, can result in substantial adverse impacts on human and environmental health beyond the individual household. And given that household level benefits of sanitation are less obvious than those of water supply, people are generally less willing to pay for it. Meanwhile, the decision to only subsidize networked services may explicitly exclude the most poor and vulnerable of society that do not live by the network. In some settings, the expansion of sewered sanitation may be cost prohibitive or even technologically infeasible. In such a setting, on-site sanitation may be the best solution to ensure that the maximum number of people possible benefit from household level sanitation. I'm looking forward to hearing more from Lusaka Water Supply and Sanitation Company in their presentation on how they are addressing this issue. Next slide, please. I'd like to now highlight some strategies that should be considered in improving subsidy design itself. First, policymakers should consider the use of alternative approaches to improve targeting. Common methods of targeting include such approaches as increasing block tariffs or IBTs. They charge a user a lower tariff per unit for lower levels of consumption and higher tariffs per unit for higher levels of consumption. The idea is that poor households consume less water than the rich and therefore benefit most from the subsidized tariff blocks. However, we now know that that assumption is often false. For several reasons, poor households may consume similar or even higher quantities of water than the rich. Therefore, alternative approaches to targeting that make use of innovative technology or administrative data from other government and social programs may better direct resources to the poor. Second, conditioning subsidies on transparent and verifiable indicators of service provider performance can avoid the inefficiencies associated with traditional supply-side subsidies. And finally, it is worth considering decoupling subsidies from service charges. That is, charging full cost-reflective tariffs to all customers, but targeting compensatory cash transfers to the poor. This way, the poor, regardless of how they get their water and sanitation services, can benefit. And being fully dependent upon revenue from customers, as opposed to direct transfers from government, can make service providers more accountable to providing the quality of service expected to those customers. Cash transfers can therefore avoid the distortionary impacts intrinsic to traditional subsidy. Next slide, please. Our final message has to do with implementation. A successful subsidy reform package includes complementary elements needed for successful implementation. Next slide. 4 elements are critical to consider to facilitate a reform's acceptance and improve its efficacy in achieving its objectives. First, complementary policy mechanisms can amplify the impact of a subsidy or even reduce the amount of subsidy required. For example, reforms to improve the efficiency of service providers' operations and maintenance activities can greatly reduce costs to the end user and therefore the need for subsidy. Second, fostering supportive coalitions can overcome the opposition of special interest groups that have the potential to block reform. Inadequate consideration of the political economy around water and sanitation services has unfortunately led to the many governments in the past having to reverse course on what were sound policy reforms that could have benefited the poor in particular and society at large. Third, a communication strategy that early and often informs the public of the reform's benefits in accessible and engaging ways can build understanding and goodwill. And finally, an exit strategy should be carefully considered when conditions demanding a subsidy are temporary. When particular user groups enjoy significant benefits from the current status quo, phased and gradual reform or removal, or even time-bound compensation may be required to ensure a sound transition to new pricing policies and gain support for reform. Next slide, please. In closing, well-designed subsidies effectively advance the goal of equitable access to affordable, sustainable, and quality water supply and sanitation services while maximizing the targeting of the poor, promoting transparency, and minimizing distortion. Next slide, please. Thank you all for your interest and attention, and we look forward to hearing from you during the question and answer period.
Yeah, thank you very much, Michael and Louis. That was a very interesting analysis on the topic of subsidies. I think one of the key messages that you mentioned is that designing an effective and efficient subsidy reform package will require complementary policy mechanisms to provide an enabling environment. You talk about supportive political coalitions, a communication strategy, and definitely an exit strategy. So we shall discuss your input a bit more during the Q&A. And to the participants, I will also post the link to the publication from the bank in the chat. So kindly bear this presentation in mind, because now we will lean towards a country case, Lusaka, Zambia, within the framework of the Lusaka Water Supply and Sanitation Company. I now hand over to Amanda Maligan to introduce our colleagues from Lusaka and set the scene. Thank you.
Thank you, Doreen. So with us, Sanitation Company, we have Matilda Mwansa and Mwansa Nachula. Matilda Mwansa has been working with Lusaka Water since 2006, and she has held the Director of Finance position since 2010. And Mwansa Nachula is an environmental engineer with over 7 years experience in developing and managing and implementing water and sanitation projects. And she is currently the sanitation specialist under the Lusaka Sanitation Program. A very warm welcome to both Mwansa and Matilda. I will hand over to Lena now, who will control the presentation for both of you, and you can just guide her through by saying next slide.
Thank you very much. I think that's a go-ahead for us to start. My name is Matilda Mwansa. I'm with my colleague Mwansa Nachula. So we have similar names. So for the purpose of not confusing the audience, I'll go by Matilda. Mwansa is Mwansa. So we will start our presentation really is from a company or utility perspective, as already mentioned. We can go to the next slide in the interest of time. Thank you very much. So Lusaka Water Supply Sanitation is currently implementing the Lusaka Sanitation Program aimed at improving access to safely managed sanitation. This is supported by the government of the Republic of Zambia through financing from the World Bank, the African Development Bank, European Investment Bank, and the German Development Bank, KfW. Additional support has been received from GIZ, as well as the Bill and Melinda Gates Foundation to complement the Lusaka Sanitation Program efforts in translating the strong enabling environment and key success factors into measurable improvement in on-site sanitation and fecal sludge management in the utility, as well as the sector in the country at large. Some of the interventions that we hope to achieve under the Lusaka Sanitation Program include expansion and rehabilitation of sewer network, including treatment facilities, construction of improved household sanitation facilities, and institutional toilets based on performance-based contracts and community-based mansons with a or based on a cost sharing between the household and the utility. The fecal sludge management business development for Lusaka Water Sanitation Company will be through a result-based financing scheme, as well as capacity building. The Lusaka Sanitation Program also aims to improve capacity in Lusaka Water and Storage Sanitation Company to manage citywide inclusive sanitation services that will include the establishment of a dedicated fecal sludge management unit. This has already been done and it's in place to manage non-sewered sanitation as a new utility service. In terms of enabling environment, we've seen the expanded mandate of all commercial utilities in the country to start providing non-sewered sanitation through our new Ministry of Water, Water Development, Sanitation and Environmental Protection. We've also seen the on-site sanitation bylaws being developed and implemented through the local municipality, that is Lusaka City Council. We've also seen the on-site sanitation and fecal sludge management national guidelines and standards that are supported by NOASCO, the National Water Sanitation Council, which is the regulator, as well as Zambia Bureau of Standards, that is the regulator in charge of monitoring and ensuring compliance with standards. Lastly but not the least, non-sewered sanitation as a utility service has been enabled through partnership with a private service provider. Allow me at this juncture to invite my colleague Mwansa to just take us through briefly what we have implemented and what we have done so far as these interventions are concerned to do with subsidies and non.
Thank you. Right, and so just to give a background on Lusaka. Yeah, so Lusaka City has a population of about 2.69 million. This is based on 2018 population, and then of which 70% of the people reside in what we call the peri-urban areas. So mostly these are low-income communities with people, majority of the people living below $1 a day. And then what we have seen in terms of provision of water and sanitation services, we have mostly informal and some areas and service, apart from areas where the utility is actually providing water and sanitation services. With regards to sewer network, the city of Lusaka has about maybe 10 to 14, which of the residents that are connected to a sewer line. And then also based on the FSD that we developed in 2019, we actually came to a conclusion that we have about 83% of a sludge that is untreated. And then in regards to the topic on relevant to the discussion today, before we actually started to implement the activities of the Lusaka sanitation program, we had to undertake a rapid assessment just to enable us informed, because what was on the table was the fact that there was financing, and we have about 70% of the population living in the low-income areas, which require them to access the products and services we're offering as a utility. But then for us to understand where we should intervene, first and foremost, we had to undertake a rapid assessment, and then took into consideration a number of aspects that include both the technical as well as the social aspects. But then also on the points of a utility, there are public good aspects that we had to undertake, and then also realize where is really the source of water. And so if you see the map that we have provided, that kind of shows the relationship between the sanitation facility and the underground water vulnerability that we have in Lusaka. And so that was one of the bases that we tried to utilize. And then also, we also tried to analyze in terms of the economic status of the people that are looking. We related the type of sanitation facility that they have with the economic status. So considering the graphs that we've shown in the quantiles, we had to see the least poor, we related the type of sanitation, also the most poor. And what really came out from this rapid assessment was the fact that the economic status as well as the source of water connection that people have related to the type of sanitation facility they have with regards to the sanitation ladder. And if you see in the graphs that we provided and the map, it's actually clear that the low-income areas where we are providing water at a public water source, that's where we actually see that most of these people actually did not have what we call maybe improved sanitation facility. So this helped us significantly in trying to design how we're going to provide a service with the resources that we have, but then also with the issue of sustainability. Matilda highlighted to the fact that Lusaka Water is now a Lusaka Water and Supply and Sanitation Company, meaning that now our mandate has been expanded to provide sanitation to all residents in Lusaka province. Next slide, please. And so how then did we come up to design the current subsidies that we have? I want to say, I think Mike highlighted to the fact that there's really no one size fits all. And so what we did as the Lusaka Water and Storage Company was that we needed to invest in a lot of research to help us understand what will really be feasible, and also with aspects of sustainability post the project. First of all, we had to understand the willingness of people to pay. And through this, what we had carried out was we had to do a very detailed formative research to help us design the marketing as well as how we're going to deliver the strategy with regards to upselling of our products and services. And then we also invested a lot in a market assessment to help us design how we're going to carry out the FSM business aspect. And then on top of that, we actually had to, when we arrived at the three key areas where we're going to implement the projects, which are our 3 low-income areas where we're currently constructing the household toilets, we had to do a very detailed analysis of over 10,000 households to just understand various aspects that looked at what do people, in terms of economic status, what are they looking, what can people afford? And then also what we decided to do, especially for the households, we realized from the formative research that actually maybe what was key for the utility, which is the public good aspects and providing adequate sanitation, was not really a key thing to the households. And so in terms of designing our household facilities, we actually had to carry out human-centered design, because this related to the finding of our formative research that there's people need to have a contribution in type of facilities that you're designing. And currently, the type of facilities we're designing has a lot of contribution from the households who we engage. And then we also had to look at harnessing emotions, which is something that we utilize in terms of the marketing aspect. There were seasons, and we had a relationship between how people viewed a good sanitation facility versus the health of their well-being and their family members. And so we had to ride on that for enable us implement and utilize, sell our products and services. And then also just working through the community to understand the local people that we have. How do we use the networks for us to actually send out the message or actually build and also get the understanding of the communities that we are working. And so from the survey that we conducted, next slide, please. So from the survey that we conducted, we had about 10,000 households that were sampled, and then we framed the messaging based on 3 key aspects. So we had asked households to say, if at all we are offering a service as Lusaka water or a product, if we gave a discount to say this is the actual price, and then we're going to give a discount to you. The reason why we're calling a discount was also on the aspects and the lessons learned from the various projects that Lusaka Water had constructed. I think we all understand that usually, especially in developing countries, every time there's a households here of a project, it kind of looks like, oh, we have funding, and so we're not expected to pay anything. And so that is why we framed it to say, we are not really giving a subsidy, but are giving, what if we give you a discount? So we actually, from this, the study that we conducted, realized about 7% of the people actually said they'll pay for a product or for a service if at all there's a discount. Then we also try to frame, if we frame the message in terms of the legal obligations. Matilda earlier alluded to the fact that our local authority has developed bylaws. So we try to say, look, you have a legal obligation as a household to have a proper sanitation facility, as well as get a service in terms of emptying. And if at all you don't adhere to this, there are these circumstances. And the response that we got, we had realized that about 91% of the people said, if it's my obligation, then they are going to pay for it. And then in terms of economic status, with regards to the residents, we saw that there was about 16 to 23% of people telling that if it's going to increase their rental, or if they think they're going to get tenants permanently, if they have a good sanitation facility, they were willing to actually have the facility constructed or actually pay for FSM service. And so based on this, we were mindful of the fact that usually when you have a subsidy, you want to talk about targeting, but also from the experiences that we had, we realized that we are first of all working in what we consider low income areas, and we really didn't have a very systematic way to say these were the less vulnerable versus the ones that are well off. So what we did is we went into the communities which are low income areas, and we actually framed our message to say Lusaka Water is offering a service. You can either empty your pillar latrine or have your facility constructed through a discount. So I'm just going to run you through how we designed first of all in terms of the household toilets. I mentioned the fact that, next slide, please. I mentioned the fact that in terms from a formative research, we realized that there were 2 aspects in regards with the sanitation facility. For the utility, the key thing is the public good aspect and also preventing underground water contamination, as in the case of Lusaka, where about 40% of our water comes from underground water which are provided. And so we realized that as a utility, our concern was a superstructure. And then from a formative research, it was very clear that the household cared more about what they did not see, which is a superstructure. And so in helping us design how we're going to administer the subsidy, we actually had to look at the initial unit cost of a superstructure for the household facilities that we are constructing. And then we designed our messaging in a way that we actually show a full cost of this facility. And then instead of us saying that we are giving a subsidy, we are saying we are offering a discount at this discounted stage. And with regards to the messaging, just to tie in the aspects of commercial, technical aspects and also the messaging, the household, what we realized is the fact that most households felt the need to actually improve their sanitation facility when they realize that it actually has a lot of implications on the health of other people. In 2017, we had a case of a cholera outbreak, and in turn, trying to frame the message, we actually realized that we engaged the household and explained to them the effects of not having a proper sanitation facility versus it contributing to the fecal-oral contamination, and that resulting in outbreaks of waterborne diseases. And this has been to date, this is the messaging that we framed, and up to we started the construction of the household toilets in 2019. We have a target of about 5,500 under the project, and to date, we have over close to 2,000 households that have paid the 2,400. And we have also, we've tried to invest a lot of time in trying to analyze the pattern and also refer this information that we have based on the initial analysis that we did. And so far, there is a slight comparison of about us having about 30 to 35% of the people actually, which translates to about the 67% that we are having. And we project that towards the end of the project, we might actually achieve the 67% and slightly higher based on the way we frame the messaging and the fact that the households are paying for the superstructure and then the utilities subsidizing for the substructure. The reason why, another reason why the utility thought it was very imperative for them to invest in the superstructure was mostly based on the FSM business plan that they have. So next slide, please. Yeah, so in regards to why we thought it was very imperative for the utility to actually invest in a superstructure was because of, first of all, the change in the mandate that we have as a utility and the need for the utility to improve on the FSM business. So currently what we have is, because we didn't really have standard designs of the household, the pit latrines that were constructed in our low-income areas, we have varying types of facilities that some are easy to empty and others actually it's impossible to empty. And so what we designed is we made sure that we came up with designs that the minimum of the facilities we're designing is actually, it has to be emptiable. But then also from the market assessment, we realized that we had private operators that were working in the city, as well as a lot of community-based enterprises that were offering the FSM service. From our market assessment, what came out was the fact that we realized that in terms of the septic tank market, it was more or less matured, but then the pit latrine market was mostly dominated by the community-based enterprises, and then the private operators that had the capacity to actually empty and improve the service of emptying were not really emptying, intervening in the low-income areas. So in terms of us designing and also the aspects of us improving this market, we came up with the results-based financing, where we had to understand how much it actually is a full cost of emptying a facility. And then we had engaged the private operators to actually, through a tender process, but then also to just understand what really aspires them. In a nutshell, we designed the performance-based contracts to help us, first of all, mature the market, but then also provide an affordable service to the households. Because if it's going to be affordable and efficient, we needed the private operators that had a lot more capacity to empty the pit latrines. So how we designed this is we set up a standard fee of about $12.5 per cubic meter for each household. Where this came from was the fact that we previously, like I mentioned, we had a cholera outbreak where we had worked together with the local authority, and the government helped us subsidize the emptying of the latrines when we realized that part of the contribution to that the outbreak was the fecal-oral contamination. And so the response that we received through that pandemic helped us design to say, look, our households were able to pay $12.5 per cubic meters. And so we had asked the private operators to give us a top-up fee for them to actually have an effective business. So what this top-up does is the fact that it actually gives a full cost per cubic meter to the private operator, and then as Lusaka Water, we offer the top-up, and then the private operators get this 12.5 to the household. And to date, in terms of FSM business, what we have seen is we started, the contract started running in January, and so far we have seen an increase of about 30% from the amount of sludge we were receiving from pit latrines last year compared to what we had have now under this results-based scheme. I will allow Matilda to come back and just conclude on the activities that.
Sorry, we're quite over time. So if Matilda will be very, very quick, as in 30 seconds, then we can allow, but we're quite over time already.
Yes, so thanks.
I think we'll move on to the next agenda item, but thank you very much, Matilda and Mwansa, for that very informative and interesting presentation, and really highlighting the key lessons from Lusaka on the need to design subsidies that are customized towards market-specific opportunities, and also highlighting that there's no one-size-fits-all. I think it's worth noting that some of the key lessons learned regarding the implementation of subsidies are also highlighted in a recently launched GIZ publication, Toilets on Discount, and my colleague Doreen will actually post the link to that publication in the chat. And the next colleague we will hear from is Ralph Eberhard. And Ralph has 25 years experience advising governments and development agencies on water policy, institutional reform, regulation and utility management, primarily in Africa. And Ralph has also co-authored one of the World Bank publications, Providing Water to Poor People in African Cities Effectively, Lessons Learned from Utility Reform. And he has also led a review of African urban water reforms in 5 African countries for GIZ. Ralph will first respond to the 2 presentations and highlight some ideas on how we can make subsidies more visible and transparent within the sector. And I welcome Ralph very warmly, and I hand over to you.
Thank you very much, and good afternoon, everybody. My presentation is very brief, and it just is picking up on one aspect of the 2 presentations. I think both presentations are excellent in terms of the work that's been undertaken and the impact that those are having. So the World Bank has made a fantastic analysis of the overall subsidy situation globally and looked at different countries and shown the key characteristics of those subsidies. And then Zambia gives a good example of taking that information and then designing subsidies in a context-specific way for a pro-poor subsidy to poor people for sanitation. I want to just deal with the issue of the incentive to change and talk about the issue of transparency in subsidies as one mechanism through which we could create some momentum for change, because the existing subsidies are there for a reason, or the characteristics are there for a reason, and we need some motivation to change that. If we could have the next slide. I'm going to build my presentation both on the World Bank report, and you'll see that I borrowed 2 of their slides, and it also is based on some early work done for GIZ. So the bank work has shown that 300 million or odd, I think they used a figure of 320 million, only 6% of that goes to poor people, to the poorest 20%. So less than 20 billion of that 320 billion is actually targeting poor people. And if you put the total amount of subsidy in the globally compared to the annual investments required to meet SDG, then you can see that the existing subsidies are very, very significant. Next slide. So the bank showed that subsidies are pervasive, expensive, poorly targeted, non-transparent, and distortionary, and I really want to pick up on the issue of non-transparency. And the proposition is that these subsidies continue to be pervasive and expensive and poorly targeted precisely because they are not transparent. And if we were to address the issue of transparency, we might create more incentives for changing the existing subsidies. Next slide. It also picks up on the bank slide around complementary initiatives and the recognition that there needs to be a communication strategy to complement a smart design. And so what I'm really speaking to here is a way to convey something about the existing subsidies that can lead to a change in the subsidies. Next slide. So the inspiration for the idea really comes from the shit flow diagram, and what the shit flow diagram has achieved is it has managed to change the conversation around how fecal waste is understood and managed in many cities. And the idea was to say, can we represent what is happening with fecal waste in a city in a simple and clear way, and use that as a way to have a conversation about how to manage this better. And I think that the diagram has achieved that in a very significant way. It's some key features about this diagram is that this diagram is done at an appropriate level. So it's, in this case, it's for a city, and it's understanding how human waste flows through a city. The presentation of the data is incredibly clear. It's very hard not to quickly understand the key message from the diagram, what proportion of human waste is not being safely managed, and where those flows are coming from and where those flows are going to. And importantly, also the process through which the diagram is developed is a process where different stakeholders get together to understand the system, and through that process of the conversations that they're having to develop the diagram, they are also beginning to understand the problem and then be in a position to think about how they can address that problem. Next slide, please. So the idea, or the question really is a very simple one, and the question is, can we or should we develop an equivalent of the shit flow diagram, something that we could call a subsidy flow diagram, something that would make subsidy flows visible, something that is easy to understand, and something that would shift the conversation on subsidies. The target I have in mind here is really the consumption-based subsidy applied to urban water as a very big sink of existing subsidies, and we know that those subsidies are regressive. So if we can have a conversation about the regressive impact of those subsidies, we could potentially release a significant amount of resources that could be made available to connect poor people to the network and to make more subsidies available for sanitation. There has been some initial work done by GIZ on this, a short paper on a motivation for something like this, and some initial concepts to inform a discussion around this. But what is really needed is a crystallization of the idea, perhaps through a workshop, to get to a kind of an equivalent of a shit flow diagram concept. And then also to use the shit flow diagram process as a template for taking it forward. So that there was a very successful way, once the shit flow diagram had been conceptualized, there was a very successful process to pilot it, to refine it, to disseminate it so that it became something that was widely used and has had significant impact. So the question really to this audience here is there merit in such an idea? Would you support taking something like this forward through a mechanism of a workshop and piloting process going forward? Thank you very much.
Thank you very much for that insightful analysis, Ralph. And we will now move to the Q&A A section of this session, and I see that we've already had quite a few questions and also answers in the chat box. Maybe I will first just pick up on one that hasn't been addressed from a Joa Parker in Lusaka, and this was aimed at Mwansa and Matilda. Sorry, I didn't open the little thingy. And she asked, what role, if any, does the private sector play in terms of finance? Besides government support, is there any local investment into the Zambian water supply and sanitation sector? Mwansa and Matilda, or Matilda?
So I think in terms of, if I got your question correctly, on the role of the private sector with regards to sanitation provision, right?
Yes.
Yes.
Okay, yes. So I think it could be seen in twofold, and I think Matilda will lean more on this. But then just to explain, just on the fact that on the current works that we are doing, if you got us right on how we have structured our contracts, we can say the role in terms of what the private sector is contributing, I think it's in twofold. First of all, they've got the expertise in trying to, in terms of emptying particular trains, but then also secondly, mostly what they're using is their equipment. They've come up with their equipment, their infrastructure that they're currently using. With regards to the broader perspective of really the private sector coming in, I think the one significant example we have seen in terms of Lusaka is the LWSC project, which is a water security initiative project that is mostly spearheaded by mostly the private sector with support of ZAMBIA, NOASCO, and the other utilities. And basically, this, yes, does not directly speak to sanitation, but it's a fact that we want to secure our water resource, which is the key water source for water that we are providing to Lusaka Water and Storage. And so what the private sector is basically doing is trying to mobilize the financing around us protecting the well fields in Lusaka to ensure that we provide safe water and sanitation to our customers.
Thank you very much, Mwansa. Just another one in the chat box from Andreas. One general remark. I would be happy if it is carefully distinguished between investment subsidies and operational subsidies. After that, we can have a better look through the lens. So I don't know if maybe the World Bank would like to take that and give us a...
Sure. I mean, as we made the presentation and in the report, somehow in principle we are agnostic in terms of what should, I mean, agnostic for the sake of the report in terms of what should be subsidized, right? I mean, and there was somehow a previous report of the World Bank done around more than 15 years ago that they were arguing that probably if you would like to target the poor, it's better to subsidize investment, let's say capex, rather than the opex, and to use this as a mean for targeting the poor, right? Because I mean, in principle, the people that don't have access to a given service is presumably poorer than those that are connected. I mean, and that principle is okay. However, what we argue in the report is that we can be even smarter than that. At this stage, we're still, in most of the countries, thinking about subsidies as we have been thinking on for the last 15, 20 years. And nowadays, first, we have more knowledge in terms of what's happening here and there, but even more important, but probably we have more data, right? So the presumption that we can identify poor just for the lack of service is a good approach whenever you don't have anything else for the targeting. But at this stage, with data, with big data, with surveys, with censuses, and even with some of the information that we are nowadays using in terms of remote sensing, etc., we can definitely be better targeted on identifying who is poor and who is not poor. However, what's important, and I think that hopefully we were able to convey that message, is that even if we sort out the CAPEX, there is still some segment of the population that will need the support on the OPEX, on the operational maintenance. So there are people that cannot afford to pay the bill, even if we fully subsidize the access to a given service. I mean, and that probably is something that we want to challenge to the common wisdom on just subsidizing CAPEX without considering about OPEX. Over to you. Thank you.
Thank you. Another question from Daniel Nordman to Ralph. The question is the idea in the subsidy flow diagram to include all subsidies, including the DFI provided concessionary finance or grants to water? For example, KfW in Lusaka is mainly financing sewerage, benefiting mostly the top quintile. Do DFIs want this transparency really?
Thank you, Daniel. Yeah, it's a good question about who wants transparency. So transparency usually benefits the people for whom it's not transparent. So I think a key aspect of this would be, who would drive such an initiative, and how would you create this transparency? But in principle, the idea is to the nature of and extent of subsidies at a more disaggregated level. So you could think of it as a city level for, you could think of an analogous sanitation subsidy flow diagram for sanitation at a city level, or you could think of a water subsidy flow diagram for water subsidies at a utility level, and understand what subsidies are coming in, including concessionary finance, and who is benefiting from that, in order to inform the subsidy design process and create some incentives for that change. So there are a number of complexities in it, and perhaps that's why it's not been done to date, but I think it's possible to abstract from what is complex and to represent the essence of where the subsidy is coming from and where it's going, to inform a better informed conversation around how to change it.
Thank you, Ralph. Maybe just another question that was also proposed to Mwansa and Matilda was, what are the biggest challenges in convincing government of the need for subsidy reforms? So I don't know if
the challenge is there because government is trying to look out for access to all, but at the same time, government wants to ensure that there's cost-reflective tariff, and then the utilities are operating on a commercial basis. So really, even in trying to design subsidies, you have a challenge of to what extent should the subsidy be done. And what we, from Lusaka perspective, we try to overcome this challenge through wider consultation of all stakeholders, but also, as Mwansa presented earlier, we did do a survey. We took advantage of the outbreak of the cholera situation we had in 2018 to really focus, and that was our starting point. And thereafter, we created demand and showing people that we can't give this for free. You have to contribute something so that also we build capacity, but also ensure sustainability, as well as ownership, especially by the target group. Thank you.
Thank you, Matilda. Maybe if there's, I think the other questions have been addressed in the box actually directly. Here's another one from Simone and to Ralph again. Can you compare the subsidy flow diagram with the classic sector-specific detailed, in brackets, public expenditure review, which normally includes all types of transfers?
Yeah, thank you. So a public expenditure review would be an excellent tool of analysis to understand the flows of money and the flows of subsidy. Those are usually done at a national level. I think the idea here is to take that analysis and bring it down a level to a utility or to a city to have a conversation at that level. It could, if there's a regulator involved, involve the regulator in that too. And it's really to help inform the process around pricing. So subsidies and pricing are very closely related. So because pricing, if you're not pricing related to cost, then you are creating some subsidy in the system. So the conversation about how services are priced and how subsidies flow are very linked. And so it's appropriate to have that at the level at where those decisions are being made. And in the case of utilities, it's usually a tariff decision being made for a utility by a government or by the regulator. If it's the pricing and cost of sanitation services, it's often being made at a city level or municipal level. So those would be the levels at which you'd want the analysis done to inform the decision making.
Thank you, Ralph. And maybe just another question to Mwansa and Matilda around the sustainability of the subsidies post LSP and what the plans around that are.
All right. Okay, thanks, Amanda. I think Mrs. Matilda I slightly touched on the sustainability aspects, and I think that's one of the lessons learned. What we have tried to do as Lusaka Water and Storage is the fact that and I think I've seen it as one of the discussions around the chat, is the fact that through our regulator, we are able to actually have a surcharge on our water bills for our customers, and this has actually previously been done before in Lusaka Water and Storage, where we are able to get a surcharge and ring-fence and invest that in various projects. And so in this case, what we are trying to do is to ensure that we upscale the delivery models and the existing subsidies that we have currently under the LSP, and then engage NWASCO. So discussions around the business plan has already been drafted, and I think we have started the initial discussions with NWASCO to see how then do we start to reactivate our sanitation surcharge to ensure that we ring-fence. But also one thing that that is in terms of sustainability, but then one thing that we're also looking at is the fact that we will not maintain the actual subsidy that we are offering right now, because it also talks about the reflective cost. So apart from us trying to invest the funds, we're trying to also make sure that our customers are also alive to the fact that this will not be for this period and this subsidies might change. The one thing that we understand is we cannot quickly jump to say get the full cost of a sanitation facility or offer the full cost of emptying, but we want to be gradual to ensure that we have at a certain point, which is like in our 5 to 10 year plan, we have the full cost reflecting on the household to either construct a facility or empty a pit latrine.
Maybe just also to add on from a customer point of view in terms of sustainability, the new tariff will take into consideration, of course, it will be similar to water, which is cross-subsidized. So like somebody mentioned earlier, the assumption is those in the lower income brackets tend to consume less water as compared to those in the high income brackets. So even with sanitation, there'll be that cross-subsidization so this really is to ensure that the low income group are able to access and continue to access the sanitation services affordably, but also, like I keep saying, for ownership, we want them to pay something so that they realize the benefit, but also ensure that they appreciate the service that is there, but also sustainability for the commercial utility company. Thank you.
Thank you, Mwansa and Matilda. I think we will move on from the Q&A section of the session. Once again, I thank you to all of the presenters and also to the participants for engaging through the chat. I will hand over to Doreen.
Yes, thank you very much, Amanda. Thank you all. We shall consolidate the input and also provide a summary of the questions and the answers that have been discussed. And as I mentioned earlier, the recording of this session will be shared with the participants. So where do we go from here? How can we take this discussion further, and how can we ensure that we design well, that we have well-designed subsidies that target the underserved and marginalized? I'm now going to hand over to Rolf to give us a wrap-up and some closing remarks in this session. Thank you.
Thank you, Doreen. I'm not sure that I can fully answer those questions, but I'll try just to summarize the key messages I think that have come from the session. And I think we could summarize them as 4 key messages. So the first message is that there are in place already very extensive subsidies, and these subsidies are not doing a particularly good job. So they're not really achieving, I think, the objectives that we would hope for with those subsidies. I think the second message is that although we know that subsidies are needed, and we also know that it's possible to do them much better. So we have now the tools and knowledge to design much smarter and more effective subsidies to meet the goals that we set for those subsidies. The third key message would be that there is no one-size-fits-all thing for subsidies. Subsidies are context-specific. They depend on the local context. They depend exactly on the objectives that you're trying to achieve. And so there are principles and processes to follow to get towards a better designed and implemented subsidies at a local level. And some tools for that have been provided very well by the bank and others to do that. And then the last message would really be about the incentives to change. So what are the incentives that would change the system to get towards better use of subsidies? And the lack of transparency was raised as one key issue that might be preventing that. So how to increase transparency around existing subsidies and their effects. But also mentioned would be how to develop coalitions, how to take this to the political and policy level to reform the tariff policies at a political level to create the conditions for better use of subsidies. So these are all areas to address. The one thing that we didn't speak about very much was the role of financiers. So financiers are providing a lot of money into the sector, particularly development finance institutions in developing countries. What role could they play in conversation with governments and with utilities around the smarter use of subsidies? And I think they could have an important role to play in that. And I think if you look at the Zambian example, then I think you'll find quite a good example of putting all those things together. So one could argue that the transparency around the shit flow diagram created some incentive to have a conversation around fecal sludge management in Lusaka, which led to a conversation around citywide inclusive sanitation, which led to a conversation with financiers about how to finance a a sanitation project that would be inclusive and address issues of access to sanitation by poor people, which then led to a conversation about how to design subsidies to promote that. So that's a good example of all of this coming together, and we could think about that maybe as a way of moving this conversation forward in other areas.
Yes, definitely. Thank you very much, Rolf. We've now come to the end of the session. Again, a warm thank you to the World Bank colleagues, Louis and Michael. Thank you to Matilda and Mwanza for giving us an overview of the experiences that you currently have within the context of the Lusaka Sanitation Program. Thank you, Rolf, for summarizing the input and giving us a more in-depth understanding of the need to have a subsidy flow diagram. And last but not least, thank you very much to the participants. Thank you for your interest in this very critical topic within our sector, and we look forward to seeing you in the next sessions. Thank you. Bye.